Up next on UBC, brought to you by...
Make calls from Airtel to all networks at 3 shillings per second.
Airtel, the smartphone network.
333. What's up with number 3? It's 3 at Airtel and not 4 anymore. It's 3 shillings per second across all networks in Uganda.
Make calls from Airtel to all networks at 3 shillings per second. Get to talk to anyone on any network anytime at 3 shillings per second. Ha ha! Tuanzi Soze!
Airtel, the smartphone network.
Airtel is regulated by Uganda Communications Commission.
Famous for her contribution towards the improvement of education in her district, Honorable Sheila Mwine is the firstborn in a family of 6. She hails from Migamba village in Rugonji parish in Kenshuga sub-county in Chirhura district. She is married to Mr. Mark David Mwine and they have 5 children. She is the district woman representative and NRM party bearer, member of parliament for Chirhura district. Honorable Sheila is a legislator and an educationist. She holds a Masters of Education Organization, Planning and Management from University of Reading, UK, 2005. A Bachelor of Education from Makerere University, 1996. Diploma in Education from Institute of Teacher Education, Chambogo, 1990. Uganda Advanced Certificate of Education from Gayaza High School, 1988. Uganda Certificate of Education from Gayaza High School, 1985. Before joining Parliament, Honorable Sheila worked as a District Education Officer, Chirhura District Local Government from 2007 to 2015. She also worked as a head teacher of Bishop Kivenjere Girls School from 2001 to 2007. Deputy Head Teacher, Bishop Kivenjere Girls School, 1997 to 2001. And a teacher in Kinoni Girls School, Mbarara, 1991 to 1994. Honorable Sheila Mwine is a member of the 10th Parliament, and other responsibilities she holds in Parliament include a member on a committee of commissions, state authorities and state enterprises, COSASE, and a member of the Committee on Education and Sports. The constituency she represents, Chirhura District, is located in western Uganda. Its population is 328,077, the majority of whom are cattle keepers. Chirhura District consists of Kazo County, Nyabushonzi County and Kashonge County. It also has 18 sub-counties, 91 parishes and 560 villages. It has got 220 schools in total, 16 nursery schools, 183 primary schools and 21 secondary schools. Today, we host Honorable Sheila Mwine on Ask Your MP.
How do we make health services much more better than they are today? Maybe that's the question I can ask her.
Welcome to Ask Your MP. My name is Oluka Jamila and you're watching UBC TV Inspiring Uganda. In this program, we bring you the members of parliament where we ask them to account for why they are voted in parliament and what prospects they have for the future for the voters. And today, for the very first time, we are hosting a female MP from Chirhura, woman MP Chirhura district. And I would like to welcome you to our show. You're most welcome, Honorable Sheila Mwine.
Thank you.
It's a pleasure to have you here on UBC TV Inspiring Uganda. You being the first female MP we are hosting here on Ask Your MP, we are really glad. And on that note, I'm really excited to ask you one question. What can you tell us about your constituency, Chirhura constituency in Chirhura district?
Thank you, Jamila. Chirhura district is a new district as of since 2006. It was carved out of Greater Mbarara, and at the time it had 15 sub-counties, but currently there are about 20, including the new sub-counties and town councils that have been created. There are about 20 lower local government units. It is situated between Mbarara, Liantonde, Sembabule, Chegegwa, and Ivanda districts. It has Lake Mburo National Park to the south, and to the north we have Katonga Game Reserve.
So actually the district is well covered, because now that means there is a tourist attraction there.
Yes.
Yes, but Honorable, as before we go further to explain how the district is, I'm very interested, you being a woman MP for Chirhura district, and being a lady who has been a teacher, someone who has been involved in the district level. I'm really interested to find out, how have you worked with the women?
Thank you very much. In my role as woman MP, I basically do the same things as other MPs do, the constituency MPs, but having a larger area, sometimes it becomes very challenging. And being a woman MP does not mean you restrict yourself to services of women only. Only that you manage to give them extra time, give them advantage in making use of you as their leader. So when I set out on my political career, my greatest allies were women.
They always say women back up their fellow women.
Yes, and their vote is quite reliable. So as women, I set out on the issues of education and health and community development, because most of our women are not well educated. A big majority of them are school dropouts, or even never went to school at all, and they don't have much income. They are mostly dependent on their husbands for whatever financial resource that they'll have to use in their homes or on their own small enterprises. The disadvantage of being not well educated, largely illiterate,
Yes.
Or semi-literate, is what I set out to address.
And what are those things that you really, that you have said, come rain, come sunshine, I must make sure that the women from Chirhura district must achieve A, B, C, D?
Yes, education is my key. First of all, my background personally, I'm a teacher. I've served in government as a teacher for over 20 years, and I'm retired a civil servant. And I retired at the level of district education officer to join politics. And in that office, I came across issues of the girl child, dropping out of school, early marriage, defilement, all kinds of
I can imagine
disadvantaged cases of girls who really wanted to be in school but couldn't complete their education, who were already somewhere in the system and dropped out because of one reason or another, and they only needed help and guidance. So I've been doing a lot of career guidance and counseling for both parents and students who come to me. Secondly, I've been linking mostly the girl children to institutions that support education, like the Forum for Women Education is.
Yes, so these things that you're telling us now, if we went to the constituency, would we be able to see exactly the girls you've helped and all those things that you've talked about?
Yes, we have students who needed career guidance on how to fill their forms to get admission in public universities and colleges to be able to attain government-sponsored education. Most parents don't know this. Many teachers don't give this guidance. And you find a child has studied, they've completed senior 6 or senior 4, they don't know where to go next. They don't know
how
else they can be supported. So I have set out to do this by interacting with the Ministry of Education, with the Department of Joint Admissions Board and Makerere University, so that I get information.
And how do you help them? Because when I look at the time students go to school, it happens maybe around May, I think May around June. That's the time of application. So how do you do it? Like to get all these youth from Chirihura to understand the procedures of application?
I hold an annual workshop in the district, and usually it's around May. I hold an annual workshop where I invite guest speakers from Makerere, from Ministry of Education, from the Higher Education Students Financing Board, who give the students loans, and I make announcements on radio, local FM, and I get these students together and they interact with these people. It's usually a weekend where they spend time with them, ask so many questions, and I avail the forms
for
filling. I guide them on where they should submit them, on deadlines and that kind of thing. You'll agree with me, some of these opportunities come and our offices will only advertise in newspapers, and our rural communities don't access.
Most of them don't actually access.
Not be listening to UBC or
Capital
FM where these adverts will be. So what I do is, when I get this kind of advert, then I finance it's being aired on a local FM in a local language, and then I organize this workshop where all the students maybe have finished senior 6, senior 4, those who want to go to various institutions. We hold a small mini exhibition of those institutions that are willing to partner with me, and the students get their choices.
Which is very good, Honorable.
I have an office in the constituency where I have 2 people, my secretary and a young man who is my PA, and my personal assistant has all this information. When I get brochures, when I get information or adverts, I send them so that this information can trickle down to the right people.
Yes.
And when people give me a phone call, I refer them back to my office in the constituency.
Yes.
Where we get this information.
Okay, Honorable, thank you very much. You have really exploited that about education. And you know, coming from a background of being a teacher, I know teachers will never stop talking.
I can just add one more. In my role as an MP,
yes,
I sit on the Committee of Education and Sports.
Yes.
So when we are appropriating finances, this
yes.
is one of the roles of an MP. Like this week we are busy with the budget, ministerial policy statements. I make sure that I try my best to guide, to give my all, my knowledge, my time, to ensure that
expertise.
we get, I'll tell you that we still had some sub-counties that don't have secondary schools. So in getting this policy implemented down by government, yes. I'm not using my money, but I make sure I follow through. Okay. We're going to have some new secondary schools
in some sub-constituencies.
Every year we get one.
Yeah, which is good for
you can't have
the,
all at go, because at the time I came to Parliament, we had about 7 sub-counties without a secondary school.
7 sub-counties?
Yes. And I think so far we have had 2. and one is going to be constructed.
Which is very good. But Honorable, I want to take you back to the women.
Yes.
You know, I know that most of the ladies who join leadership, mostly because of what women go through, so they come up to try to help the women. Could you explore more on what you've done in terms of helping women and health?
All right. Yeah. Health is another sector that I'm very enthusiastic about, and I have tried my best to look at what services we have in our health centers, and the hospital that we have where you visited,
yes,
is a private hospital. It's not a government hospital. We have health center 4s, health center 3s and 2s and that kind of thing, but the services provided there are not sufficient for the women's needs. You find like Reproductive Health Uganda come in to help me whenever I have extra burden for women,
yeah,
in cases of family planning and reproductive health issues. I have liaised with NGOs. Yes, reproductive health is one, but Bulamu Healthcare. We have other private health practitioners who approach me, like Maristops, and they request to partner with me. So in my time, I have been trying to bring the services nearer to the women, because usually they won't have transport, or they won't have time, or they'll have a complication that they will be afraid to talk about. So we've been holding what we call health camp, or a medical camp.
And how many times do you hold these health camps, and for how long?
Every after, say, 4 months, say 3 times in a year.
Okay.
I hold a medical camp, and I move from one sub-county to another. I partner with the local government, with the district health officials,
yes,
and the in charge of whichever health center I'll go to work with, whether it's private or government, as long as it's within a sub-county. Then we mobilize people. We get NGOs like Maristops, Reproductive Health Uganda, Bulamu,
yes,
and they set camp and provide health services, say, for 2 to 3 days.
So these health services that you provide, because what I can say is, in some of these health camps, you find that people are told to pay a small amount of fee. But I want to know from you as a woman MP, because the way you've explained to us, you've said that the people there, mostly the women, they don't have income, most of them are less educated. So when you organize these camps, do you tell them to get a fee, a small fee, to facilitate their treatment, or it's entirely free?
It's entirely free. It is my way of giving back to my community, to my voters, and it's also a way of identifying those people with complications that need further management. Because once you ask them to pay, they just won't turn up.
Okay.
So when you tell them that this service is free, then they come, and when the case is of advanced nature and needs further management, then you refer them, and at that point they can go and seek medical services.
But when they have
are
at least
available,
gotten the
when
diagnosis.
they know. First of all, we were focusing on HIV and AIDS, on hepatitis, because these were very, very serious things. Then we look at cervical and breast cancer. Then we look at immunization, because most of them will probably be having a baby,
and they don't
or they're expecting, and they need to get their tetanus vaccine or something, and they keep postponing. So when you say there's a camp, it's for 2 to 3 days, they'll come around and they'll get checked.
So do you get a lot of people, or?
Yes. We get big numbers turning up, even from neighboring districts.
So that means even your neighbors come, the other districts come and join, because it's a free service.
I'm sure even if my neighbors did, my population or my residents would go to the neighbor, because you know, sickness knows no boundary.
Exactly.
And where the service is, these are Ugandans. They just come and they are free to get the service. So with the health sector, my biggest concern and burden was that people have very poor health seeking behaviors, and it is a way of educating them to know that they need to take checkups regularly, whether they are sick or not, and once they know their condition, to follow it up and get treated appropriately, not this where they go to the clinical pharmacy and buy some
and do
drugs,
self-prescription,
which is wrong. So I've been doing that kind of health education at the health camps.
And how is the outcome so far? The way you
outcome
have
is good because after holding about 12 sub-county, actually 13 sub-county health camps.
Yes.
We had the just concluded one at the Bushiri Community Hospital, which was for the entire district, for the 3 constituencies. And the turn-up was overwhelming. We hit a record of 12,000 patients.
So now,
including surgeries, including the treatment and the referrals.
And all the prostate cancers and everything.
All these people were worked upon.
Mbuza ntata abantu aba batahwana bazagaruka kwanari. Iyo niyo first question. Icya kabiri ni mbuza sente zokoze isaho zihire eziretsera abantu ababona.
But now, Honorable, that triggers me a little bit, because if you can get a number of about 12,000 people coming for the health service, so do you think that should be your role, or government is not doing very well to help you?
Yes, it is my role partly, and on the other part, I think I'm volunteering. So first of all, in our role as MPs,
yes,
we do legislation, appropriation. Those are the usual things we do here.
Those are the
Parliament.
things. Those are the things we know as
and
people.
we do them here at Parliament, in our chambers, in our committees. But in our oversight role, we're supposed to monitor government programs.
But are you facilitated to monitor those programs?
Yes, we are not directly. Even some say mileage,
yes,
or fuel to go up country every so regularly, but you choose what you monitor and how you monitor it. So in the oversight role, I have taken it upon myself to look at the health services and the education services that the population is receiving. So the big turn up at health camps shows you that the service which is there
is good
at the health camp is good. The service that is in our health centers is good, but people are not making use of it.
Okay.
Okay? And it's an indicator that some more things need to be done. Because like testing for cervical cancer and those kind of
because I know testing for they need also a place which is a bit private, and
they are not done, and the population is not mobilized properly. So I have noted where government needs to do some more. I have also done it as a way of representing my community. I'm able to note where the services are not being given adequately. Then I report back. Of course, after my health camp, now I have something to say. I have to represent my people and say, look, we are in need of this.
To me, this camp is big. I need to know as to why this camp is not moved to lower villages where each and everyone can benefit from this, because people suffer much, especially when the numbers are big. People slept here, and up to this time they have not accessed the medical services. I need to know why can these camps be taken to lower villages.
So why did you have to choose this particular time and also this particular hospital?
Okay, thank you very much. My name is Sheila Mwine. I'm the woman MP for this district, Chiruhura. First of all, I would like to thank you for coming and for witnessing what we have been doing here. And we hope that we shall be able to test, treat, counsel about probably 10,000 people. On day one, we had over 3,000 people, and today we've handled another 3,000 people, and it has been a great exercise because the turn-up has been excellent. Actually, we at first overwhelmed, but our team has been doing a good job. They have gotten reinforcement from neighboring hospitals, and people are being given services.
So are these services for free or they have to pay some little money?
This service is absolutely free, totally free. There's nothing they are required to pay. They only have to get their transport, arrive at Rushere, be in good time, get registered, and go through all the process of getting medical services. We have medical services ranging from eye care, dental, skin, laboratory. We have maternity and cancer screening for both females and males. We have orthopedic. We have even surgery going on. We have had a number of people who have undergone surgery for various things like goiter, hernia, and various other things. So the camp has been successful in as far as the turn-up, secondly, the services that have been delivered, and thirdly, I have gone around and people are appreciating the service because it is not only free, but it is also efficient. They are getting medication. They are getting medication, and we have also people who are being referred. For cases that are quite complex, these Bulamu partners of mine, they are able to refer for more advanced services to bigger hospitals. They have ambulances, and cases that need specialized treatment are being referred, and those people are being helped because they will be paid for even when they go for advanced surgery.
So are you the one who's going to pay for them? Or
no, we have partners. We have partners who are based in America, and Bulamu is championing this. They have done this in various other places, but in my case, they came to partner to give first-hand service here, and then also referrals, which they continue and pay for, and even follow up. We have those people who have been in theater, who are on the ward, who have been admitted. We are going to keep here with them until they are discharged. We have to do follow-up on them, on their cases, and all this is free of charge because we have sponsors. We have partners. We've also had some partners from local partners here, like DFC Bank, like Rushere Sacco, and NIRA, as far as giving refreshments to our workers, our health workers.
So just about to ask, what about the people who come in? Are there like refreshments
Yes,
for them?
there are lots of refreshments. We have drinks. We have our canteens are well stocked, and Rushere Hospital in particular has been able to provide meals for our health workers, both the resident and the visiting health workers. So myself as a partner, I have put in some money. I don't want to disclose how much because it is quite an amount. But Bulamu has done a great deal for us, and we appreciate them. And the local community has also helped us a lot because during the mobilization, we used the local FM radio here. During preparations, we used the business people in this community, and I have had great support and partnership from these people because this is a service that we haven't had in a long time.
So I was about to ask you that when do you happen to organize such a big function? Because when we came in, we thought there was a rally going on.
Oh yeah, yeah. Now, I've been, since I went to Parliament, which was just a few years ago, this is my first time in Parliament, I started on this business of campaigns. Health Camp helps me to campaign for good health. The community that I represent have their literacy level is relatively lower than most other communities in this country because of our pastoralist nature, and we're just beginning to pick up some of these things. So health-seeking behavior is one of those things that are new in this community. You find a person has been sick and they are not doing well in looking for services. They'll wait until they are really broken and they are down, and they'll be taken wherever they'll be taken. So I've been on a campaign trying to teach people to go for checkups, regular checkups. I've also been on a campaign to tell people that, look, there is free services in the cases of HIV, in the cases of hepatitis, they should only go and get tested, and then they can get treatment if they need it, or even vaccination where it is needed. So I've been on that campaign of health improvement, of the health status of our people, and people are picking it up. So I started with small mini health camps in the sub-counties. And while there, I discovered that there are people with complex cases which we could not handle at the sub-county health centers with the few health service providers that I would have invited, because I've been working with Reproductive Health Uganda all along, and a few clinics like Ebenezer from Ibanda. Yes, yeah, that has been my campaign. Being a woman MP, I was campaigning for women to go and test for cervical cancer, and along the way I discovered that we had other complications that women needed treatment on. Considering the size of our women, most of them have high blood pressure, others have diabetes, they don't know it, others have eye problems that are a result of diabetes or blood pressure or even age, and they don't know. So in that campaign, we discovered that we needed more help. We have orthopedic cases that have been poorly managed locally. We have people who have been misguided, and rather than go for medical treatment, they go on herbal and they forget to go. We have people who have been on wrong diet for their kind of complications. So all this we discovered with my team as we were going along in the sub-counties, and that's what caused me to want to seek out for a partner like Bulamu in Healthcare International to come and give us support in treating our people.
We have appreciated the way they are welcoming people and how they are treating them, and the order of this service which has been taking place here.
We have been with an argument comparing her with other MPs. To me, is the best performer among men because she has tried very much, especially in education department, especially in health, because this is her almost like a third time with such camps in different counties, except this one is at the referral level. That's why it is here. But I credit her very much.
And your name again?
Akampo Frank.
When is the result-based financing coming to our facility? That's what I can ask. When would the result-based financing come to our facility? Because once the result-based financing come, it makes the health service a little bit cheaper for every community, every individual, and also for all the community members. They are accessing quality health, but cheaply. You are getting me? Because who is financing it? The government becomes fully responsible for financing the health services. At the same time, also the hospital is getting some finances. So there's a win-win situation at all sides. The government is getting something, and also the community is getting something.
Does the government come in to help once you put your statement there that this needs to be rectified? Yes. Because health, apparently, what I know is, in Uganda, health is one of the issues that is really, really paramount. Everywhere you go in Uganda, you find that these things keep happening. People need health services, and it's always the same thing. So in your particular constituency, if you are to rate yourself, do you think you've performed to that level? You think, okay, now government can come in and help?
Yes. I must say that government has its set and standard service providing mechanisms where they have health centers, they have deployed health workers there, they have a budget, they have medicine sent there from national medical stores, they have a district structure for monitoring of the staff and the drugs and surveillance for sickness and that kind of thing. Yeah? But the way the service is taken, because the health center is not going to go looking for people to treat. People should come. So once we realize that the services that we are providing are not sufficient, then government can step up.
Yes.
Effort. Maybe it's in the amount of drugs sent or the kind of drugs sent. I'll give you an example. Malaria used to be very, very high in my constituency, Chilhura, in my district.
Yes.
but it has gone down.
What have you
due
done
to the government efforts of mosquito nets, okay, of health education, of village health teams,
and providing drugs,
and the availability of drugs, first-line drugs for treatment, and the great work of the health workers. I don't want to take the credit as politicians. This is the work of health workers. But you know, as a
politician, you have to push them sometimes.
Now I'm asking her, how does she organize this in order to see that every person, every people in the country that is good, even to see that if she comes anytime that she wants to be with everyone, what can she be looking for? And another, it's like, how does she, what comes into her mind to care about people's life?
Hat MP wetu ni mbuzeji. Ni mbuza hata okureta kampu ejaha nkawen chimuyamba chi ninga na bitahiza munkai kandi chinde ekigendererwa ky'emunonga ekimureteire okufaha abakazi munonga n'okufaha ngu baragurira abakazi kansa ya nyinenda n'ey'amabeere n'ezindi endwara zoona ekigendererwa kye kibe kirikiye.
We come in to help, okay? We come in to support government, and also we identify partners outside government. So when I talk of Maristops, Reproductive Health Uganda, and Bulamu, all these are partners. They are funded. They don't need government funding.
Okay, so they just partner with them and they do charity work.
They do charity work. I do mobilization. I liaise with the local government, with the health workers, with the health institution that we decide to work with, like Rushere Community Hospital, which is private. So I do the linking, I do the mobilization, and even facilitation at some point where it is needed, because they have their set areas, and I also have my set areas. So we come in to facilitate where government service is not sufficient, and also take note of the needs and represent my people by bringing them back to government and say, look, this is needed, this is not sufficient.
Kikuru munonga no kugira ngo abantu baguma batunga ekikwata amagara okufayo munongo kwekebeza endwara zitakakuzire zitakarengere nka cancer, cervical cancer, prostate cancer n'ezindi ndwara ezikubasaganze amagara g'abantu kwekebeza kare abo kuba umuntu kwakukebeza kare ndwara nikimuhwera okugimanya akaraguza nare kiba yagira mu stage ya haiguru akatunga treatment eri kubasa kumara.
Dr. Chitrura Hagaisande, Hospital Director, Rushere Community Hospital. We are very glad for what has happened. The Bulamu Healthcare coming into Rushere Community Hospital to provide a service to the community, which is very, very important. And most of all, also to make sure the service is as free as possible. And the service that they're at a wide range, not just basically only one service, but multiple services, ranging from general medicine to surgery, pediatrics, and also not only stopping here, but also referral system being integrated in this, so that if something not done in the camp, it's referred to much a higher place.
So have you been doing referrals, and what can you say about the issue of sickness in this area, because it looks like there's a big turn up of people? Is it that the hospitals are not doing their job, or it's because it's free?
I think what has happened today, beginning from Monday, it calls for a lot of stakeholders to sit and redesign and reorganize the health system, most especially in Chiruhura. This camp is not going to leave us the same. It's going to bring the stakeholders together to rethink of how health is moving on, because free things, we've seen how they are bringing in so many people. So how can we make health service as cheap as possible to everyone? Are there policies that are going to support this? Are there, the policies are there, but are they reinforced? And also, the health burden. It has been so much obscure until this time. We have been seeing a few people coming to the hospital, but with this happening, we have seen so many numbers coming up. And this is also people coming to about 4,000 in one day. So it's a big number really. So such a number, it means that they have been with illness for a longer time. And also I think we all need also to do a lot of community education about health. That you don't have to wait for a camp to come in your area for you to go to the hospital. You should be having this culture where you go to the hospital as early as possible. Even when the sickness is small, you should go to the hospital so that you don't find yourself in a situation whereby the illness has become a burden to yourself.
Sima munonga abo katkorire kintu cyamani turemirwe gwenkanye tijine kaseni koko zo mu clinic iroko yatkorire cyamani
Among the activities that I do, especially to encourage education among our youth, I hold talk shows on radio, in the local FM radio whenever I have time. I visit the secondary schools. I hold meetings with teachers, and I also do follow-up meetings for the students who are at university. I have visited Makerere, I've visited Chambogo, UCU Mukono, and KIU, even Mbarara, the three institutions that are there, that is Mbarara University of Science and Technology, Bishop Stewart, and these other colleges, constituent colleges of MOBS and UMI. They usually gather together and give me time. I go and give them some mentoring talks, guide them, attend their functions, and my biggest interest in that is to inspire them and to answer their questions. As young people, they probably have questions on their education, on their social life, and on work after school, on jobs and that kind of thing.
I think that's okay. As we go for a break, we'll leave Honorable Sheila Mwine, woman MP from Chirihura, to think about the challenges that she has faced as a member of parliament. For now, let's go for a break. You're still watching Ask Your MP with Oluka Jamila. Welcome back to Ask Your MP. My name is Oluka Jamila and you're watching UBC Inspiring Uganda. Today in studio we have Honorable Mwine Sheila from Chirihura District, woman MP, and we've heard a lot from her. She's talked a lot about how she's helping the children, the women, the youth, and also working very well with the leaders in the district. Now, after saying all this, I'm really interested, just like you there, to find out from her. Honorable, back to you now. What are some of the challenges that you have faced as a politician, as a leader, as someone who has worked in the district? Because you have a background of working with the district for quite a long time, and now you being at a top leadership level in a district where everyone looks up to you. What are those challenges that you have faced as that kind of person and as a member of parliament?
Well, challenges are many, but I can just point out just a few. First of all, time. Being an MP is not a simple job. You have a lot of work in the office at Parliament. And if you're a person who is so committed to your work, you find it takes a lot of your time and you hardly have time for your constituency. You sit on two committees, like I'm on education, I'm also on COSASE.
And COSASE is that committee which is hot.
A person who is so keen to follow through, start something, you want to be able to be following the proceedings from the first day to the last day. You don't want to miss. And it takes a lot of time. It takes a lot of reading and concentration, so it makes you very tired. And at the same time, you have a family. you also have a constituency, and you need time for the functions in the constituency. The public out there don't understand that you have to divide your time. You have to have, once you are elected, they think you are elected to remain.
Yeah, because for us
But
voters,
the
we know
work
that
we are
once we elect you, we want you to be there for
To
us when we
remain
have
there.
problems, when we
Yes.
want this, we want you to be there.
They want you to attend funerals, attend weddings, attend church and other religious functions, and even traditional functions from time to time. But it's not possible to attend all of them. You can only attend as many as you can, but our core work, which is at Parliament, is not understood by our voters or the population. People do not know that we do a lot of work. They think your work is just to be
sitting in the plenary and nodding.
there and also attending their functions. Of course, there's the distance. The time you travel from Kampala to Chiruhura, it's not quite near.
No.
Although it's not the farthest point, we have people from Karamoja, from Kisoro, from
Yumbe,
Arua.
Zombo.
We have people in the islands. We all have such challenges, but people expect you to divide your time and be everywhere and be able to satisfy all of them. So time is one factor, but it is up to us as individuals. Time is not elastic.
Yeah, because they say you have to manage time.
Time is not elastic. So you have to attend your functions, you have to prioritize, you have to give ample time to your core role, which is in Parliament. Secondly, commercialization of politics, where you find that people are expecting you to be paying for each and every audience that you have to attend. If you're going to attend a church function, you must be heavily loaded. If you're going to attend a traditional function, you must come with all your friends and leave a lot of money behind. So it has turned out that a member of parliament is expected to be giving money all the time. And unfortunately, we don't have such money, because we spend a lot of it on the journeys to and fro.
Yes.
We spend a lot of it on preparing such activities.
And because people think that you always have money, like government allocates you money for the
really,
constituency. Because when you, if you compare the Parliament of Kenya and Uganda, in Kenya they give MPs constituency fund. So people assume even you are given such amount. So could you clarify on that?
No, we are not given. We are not given a constituency fund. I'm made to understand that previously it did. They piloted it and it didn't work out well. So they left it altogether. So right now we are only facilitated to be able to go back to our constituencies regularly, to gather information and bring back to government, to go and be able to be with our people. But not that you're given a fund that is there for development. No, you're only supposed to bring back the plans and ideas and whatever. You're only facilitated to go back and sit with your district council every time they have council, and you guide them, advise them. So it's not that we have funding specifically for constituency, but we use our own initiative, our own plan, because it is what our politics has become.
Anyway, Honorable,
another thing,
you can
another
just
challenge
quickly
we have is the capacity of government to provide services. Now the public, when they don't get the services they expect from government, now they turn to us.
Yeah, our
They
MP
turn
has
to
not
us.
even worked on the roads. Our
Yes.
MP has not worked on the
Yes.
health center.
We want water, we want electricity, we want hospitals, we want schools. Therefore, the MP has not done this. So it takes a lot of explaining, takes a lot of intervention, and you have to be very aggressive to be able to achieve some of these things for your constituency. So we have a lot of challenges, but I can only mention those few.
Okay, Honorable, thank you very much. At least you have tried to tell us that behind the smile there is always anything, there are always challenges, because what I know is when we look at the members of parliament, when we go to the constituents, people have that perspective that a member of parliament is supposed to do ABC, just like you have mentioned. But now when you clarify here, I believe that voters from Chirihura will understand that you do this out of your own courtesy. However, the last question I always ask everyone who comes here, should we expect you in the ballot paper in 2021?
Oh yes, I definitely would like to come back to the 11th Parliament to continue with the work that I've started. As you witnessed, there's still a big need in the sectors that I have prioritized, and this being my first term in Parliament, I have also gone through a period of learning. I've learned a lot that I've added to my knowledge, and I would like to go and support my community. I also have a lot to add to our Parliament, because in legislation there are many things that we've come across that were previously not in our kind of work or fields that we were doing. Personally, I had not been in that line of legislation or politics, but I have learnt a lot, and I feel there is a lot that we can contribute, specifically on women. So I am looking forward to the time when that bill comes and we will debate it.
Okay, that is very nice, and we will expect you on the ballot paper come 2021. So Honorable, thank you very much again. We are really glad as Team UBC TV to have you here in our shop, Ask Your MP. And please tell more other female MPs to come and tell us what is happening in their constituency, because imagine today I know that most people would imagine that Chirihura being a land where there is a lot of cows and everything, that they expect women to be educated, but today we've learned something that actually there are a lot of challenges that you face as a woman MP. So thank you very much. We wish you the best, and we will be there checking on you come 2021. You've been watching Ask Your MP with me, Oloka Jamila, and in studio we had Honorable Mwine Sheila, woman MP for Chirihura District. Thank you very much, and keep watching UBC TV, inspiring Uganda.